Should pediatricians receive financial bonuses for vaccinating your children? Should insurance companies pay doctors for vaccine quotas? And should parents know about these financial arrangements before making any medical decisions? Here's the point. On January 21st, 2026, Texas Attorney General Ken Paxton announced a landmark investigation into financial incentives tied to childhood vaccine recommendations. This probe targets pediatricians, insurance companies, vaccine manufacturers, and related entities for potentially deceptive or unlawful conduct, specifically failure to disclose bonuses, higher reimbursement tiers, contract requirements, or quotas for vaccinating children. Paxton stated clearly, "I will ensure that big pharma and big insurance don't bribe medical providers to pressure parents to jab their kids with vaccines they feel aren't safe or necessary." According to the investigation, Texas children receive over 70 shots from birth to age 18 in order to continue receiving medical care. Some children have been expelled from pediatric practices and denied care based solely on vaccine status. In many cases, doctors' wages, bonuses, and employment depended directly on vaccine administration rates. This isn't conspiracy theory, it is well-documented fact. In 2023, a leaked Anthem Blue Cross and Blue Shield document showed Kentucky providers could earn $20 to $125 per vaccinated patient based on their practice's vaccination rates, with a maximum bonus at 75% compliance. That same year, HHS Secretary Robert F. Kennedy Jr. repealed a federal policy tying hospital reimbursements to staff COVID-19 vaccination reporting, calling it coercive and stating it conflicted with informed consent and incentivized pre-scripted decisions over individualized care. In 2025, the U.S. Equal Employment Opportunity Commission secured a $1 million settlement with Mercy Health after the hospital denied religious accommodation and imposed a $60 monthly vaccine incentive charge on unvaccinated staff. And these financial pressures aren't isolated incidents. They're systemic and system-wide. So how should Christians think about this? And here's the point. First, transparency in medical care is a moral imperative, not an optional courtesy. Every patient deserves to be informed, and every parent of a young patient has the God-given right and responsibility to make informed decisions about their children's health care. When doctors receive undisclosed financial incentives for administering vaccines, bonuses that can reach hundreds or even thousands of dollars, that creates a fundamental conflict of interest that parents must know about. The principle is simple. Informed consent requires full disclosure. If a pediatrician's income depends on meeting vaccination quotas, parents deserve to know. If insurance companies pay higher reimbursement rates for practices with 75% vaccine compliance, it's material information that is affecting medical recommendations. This isn't anti-vaccine, but it is pro-transparency. Whether you believe in vaccinating your children on the full CDC schedule or spacing vaccines out differently, you have the right to know if your doctor's financial interests align with or potentially conflict with your child's individual medical needs. True medical freedom requires informed patient care. Second, financial incentives that prioritize profits over patients undermines the entire foundation of medical trust. The entire Hippocratic Oath, which has been the reigning medical philosophy for more than thousands of years, is to first do no harm. In other words, the medical profession is to be a good and a remedy for all that ails us. When doctors are paid bonuses for hitting vaccine targets, the temptation exists to prioritize those targets over individualized patient care. Some practices have expelled families who question the vaccine schedule or request modifications in the interest of their children, and children have been denied care based on vaccine status alone. This creates a two-tiered medical system. Families who comply with mandatory vaccine requirements, irrespective of actual need, can still receive care. But families who ask questions or seek alternatives are automatically shown the door. That's not medicine. That's coercion. The scriptures teach us that the love of money is the root of all kinds of evil. When financial incentives drive medical decisions rather than individual patient needs, we've perverted the entire premise of the medical practice. The physician's primary duty should be to the patient, not to pharmaceutical companies, insurance quotas, or the almighty dollar. Finally, accountability must extend beyond Texas to protect children nationwide. Texas Attorney General Ken Paxton's investigation represents exactly the kind of oversight government should provide, protecting citizens from deceptive practices, conflicts of interest, and perverse incentives. But Texas shouldn't stand alone. Every state should demand transparency in medical financial incentives. This parallels recent shifts away from coercive federal policies. When HHS repealed vaccine reporting requirements tied to hospital reimbursements, they acknowledged what should have been obvious: financial pressures that override informed consent and individualized care have no place in medicine. We must all demand accountability from big pharma, insurance companies, and medical providers. And we must protect parental rights to make informed decisions without undisclosed financial pressures. And we must restore trust in a healthcare system where patient welfare and freedom, not profit margins, are the foundations of medical treatment. Transparency, informed consent, and individual patient care must be restored as the foundations of pediatric medicine, because the health of our children and the rights of parents to make informed decisions is far too important.